This is a Medical Minute brought to you by Dr. Stephen Howell. What to expect after total knee replacement.
Recovery after total knee replacement does take some time. What's remarkable though is that when we put the parts in with cement and we put some numbing medication in the knee, the patient can actually walk that day. And about 9 out of 10 of our patients the day after surgery walk well enough, they do a few stairs, they actually feel like going home. 1 out of 10 will stay an extra day or so, whatever it required. We don't want anyone to go home before it's their time. But when they go home, in the first 2 to 3 weeks, it's a little bit sore for sure. But we give gentle exercises for you to do on your own on an hourly basis. And by a month, patients are usually better than they are before surgery. At 3 months, most people we call are about 70% recovered, but that's pretty far along. If you like to play tennis, you can get back to that. If you like to golf, you should be doing that. If you like to ride a bike, that's okay too. And bowling, so some people like to do that. You should be able to do these things by 3 months on average. At 6 months, you're 90% recovered. About 30 out of 100 patients at 6 months will say, my knee feels pretty normal like the other side. But the other 70 will say, it's still not quite a normal knee, but it's substantially better than what I had before. So I think if you take this concept that it's going to take about 6 months to get primarily 90% recovery and be a little patient with it, I think you'll get better and you'll be satisfied. There's no need to think that these things only last 10 years. In fact, the knee lasts longer than the hip replacement does. There's less wear and loosening of a knee replacement than a hip replacement. So these are very durable, much like a crown on a tooth as an analogy. These are caps that go on the end of the knee just like a crown goes on the end of a tooth. And when it's the right size, it's in the right position, and it's cemented in, it's durable, and you can eat what you want, you can walk on it the way you want, and be active.
This has been a Medical Minute from Dr. Stephen Howell. Align with the best.